Good afternoon. Just wanted to call this subcommittee meeting of Health and Human Services to order. Just want to welcome everyone to the first meeting for the Health and Human Services Subcommittee. I just wanted to recognize, if we can, a number of the members that continue joining members for the Health and Human Services Subcommittee. We're welcomed by Senator Craig Zucker, Senator J.B. Jennings, and we will be joined momentarily by Senator Heddleman. And for those that may not know me, I don't want to take it like everybody knows me. I'm Corey McCray, the subcommittee chair for Health and Human Services. And today we'll be hearing from the Department of Human Services for the fiscal 2025 budget overview. Proud to be joined by Sam Quist, and he'll be reading it out for us.
Thank you, Senator McCray. Good afternoon, members of the subcommittee. My name is Samuel Quist from DLS, joined with Tanya Zimmerman and Natalie Andrade from DLS to present the DLS analysis of the overview for the Department of Human Services. I'm going to begin on the first chart on page 2 of the report. This is providing an overview of the DHS budget by fund type. As you can see, the majority of the DHS budget is made up of federal funds. The largest component, the orange portion of the chart, are breaking out federal supplemental nutrition assistance program funds. The green portion is the remainder of federal funds. There's also a small portion of federal funds broken out on the top of the chart for the federal electronic benefit transfer program. In total, the DLS allowance for fiscal 2025 totals $4.1 billion, which is a slight decrease from the fiscal 2024 working appropriation of about $3.6 million, or a 0.1% decrease overall. I'm going to turn to the pie chart on the next page, page 3, which provides a functional breakdown of the fiscal 2025 allowance. As shown in this chart, over half of the budget for DHS funds public assistance payments, about $2.4 billion in total. The other second largest category is for personnel expenses, approximately $631.7 million. The third largest category is $350 million for the foster care maintenance payments program. The remainder of the budget funds the administrative and the programmatic expenses for the other divisions within DHS. On page 4 of the report is a higher level overview of the budget for all fund types. This chart also breaks out the funding for the federal SNAP benefits and the federal EBT program on the bottom of the chart. In total, funding for these two programs totals approximately $2.1 billion, while the remainder of the DHS budget totals approximately $2 billion. By fund type, the general funds in the DHS budget total $910.8 million. Special funds total $166.1 million. Federal funds outside of the SNAP and the EBT program total $900.4 million, and reimbursable funds total $31.7 million. By funding category, by program, the largest funding goes towards the Social Services Administration and the Family Investment Administration. On page 5 of the report, there is similar detail focusing on the general fund portion of the budget. General funds in total are $910.7 million, which is an increase of approximately $5.6 million from the 2024 working appropriation. The largest appropriation of general funds in the budget are for the Social Services Administration, including the majority of the expenses under the foster care maintenance payments program. On page 6 of the report are details of the deficiency appropriations for fiscal 2024 that are included in the budget. In total, the deficiencies add up to $125.9 million, including a total of $64.5 million in general funds. Among the individual deficiencies, the largest is a $72 million deficiency for the MD Think IT system for maintenance and improvements for costs for FY 2024. The second largest deficiency appropriation is $28.4 million in general funds for the foster care maintenance payments program to fund additional costs for caseloads and placement costs beyond what was originally budgeted in FY 2024. The other deficiency appropriations fund cost increases for a variety of administrative and programmatic costs. There are also two deficiencies related to caseload changes in the Family Investment Administration, including an increase for estimated temporary cash assistance caseloads and a negative deficiency reflecting anticipated decreases in caseloads for the temporary disability assistance payment program. The proposed budget change detail begins on page 7 and continues on to page 8 of the report. In total, as I mentioned previously, the total budget change is a decrease of $3.6 million. By program area, I'm going to start in the area of personnel expenses. The largest change is a $33.4 million increase for department-wide salary increases and associated fringe benefits. This cost increase reflects the fiscal 2024 statewide cost of living adjustment and increments. The impacts of these adjustments are reflected in the fiscal 2025 allowance. However, the fiscal 2024 allowance currently includes these budgeted under the statewide account in DBM, so that impacts the size of the overall change shown here. There's a $19 million increase for agency-wide funding to support the filling of vacant positions and align overtime and contractual employee spending with recent experience. The largest decrease in the personnel category is $6.1 million due to the changes in the turnover rate budgeted in several areas of DHS budget. There's an increased turnover rate percentage for several departments. Turning now to the assistance payment portion of the budget, the largest change in this portion of the budget is an additional $69 million in federal funds for the new summer EBT program, which is scheduled to start in the summer of 2024. There's also a $19.8 million increase for EBT fraud replacement, in part due to the end of availability of federal funds for this purchase. There are 3 other cost increases under assistance payments for costs for the state summer SNAP for Children program, the temporary disability assistance program, and refugee cash assistance to better align with recent program experience. There are several areas of decrease under assistance payments. There are decreases in the programs of the transitional support services, emergency assistance, public assistance to adults, and the child support pass-through in order to better align these programs with recent experience. There are 2 other decreases due to changes in estimated caseloads in fiscal 2025, including a $13.7 million decrease due to changes in estimated temporary cash assistance caseloads and a $61.8 million decrease due to changes in federal SNAP caseloads. Under the Family Investment Administration, the largest increases are a $12.6 million increase in federal funds for the Maryland Office for Refugees and Asylees contracts. There's a $12.3 million increase for department-wide call center expenditures and a $10.2 million increase for grants to food banks reflective of a transfer of funding that was previously budgeted under the dedicated purpose account for that purpose. I'm going to move on to the Social Services Administration. There are a couple of smaller increases in the budget for administrative costs, primarily due to child welfare services, both contracts under the Baltimore City Department of Social Services and the Office of Administrative Hearings for Child Protective Services hearings. Within SSA, there is also a $700,000 decrease related to one-time additions to the budget for legislative priorities for grants to child welfare services providers in FY 2024. Under the foster care maintenance payments program, the net total increase under that program is about 6.1 million. Under the Child Support Administration, there's a $2.6 million increase for cooperative reimbursement agreements with units of local government and an approximately $1 million decrease for University of Maryland research and technical assistance contracts. Within the Office of Home Energy Programs, there's a $4.4 million decrease for administrative contracts with local administering agencies for the administration of energy assistance programs. There are also 3 decreases reflecting changes in special fund and federal fund allocations for energy assistance benefits. These include a $3.6 million decrease in federal funds due to the ending of availability of federal low-income water assistance program funds. There's also a $5 million decrease in special funds from the Strategic Energy Investment Fund allocated for energy assistance, and a $10.3 million decrease in federal funds under the state's allocation for the low-income home energy assistance program. In the area of information technology, there are increases of $7.5 million for the EBT payment processing and information control systems contracts, and a $2.5 million increase for the centrally budgeted cost allocation from the Department of Information Technology. There's also a $63.9 million decrease in expenses for the MD Think system. This is accounting for the deficiency appropriation for FY 2024, which I previously mentioned. That's adding additional funding in FY 24 for that purpose. For miscellaneous changes in the budget, there are decreases in department-wide communications and rent expenses. There's a $12.9 million decrease for the Montgomery County block grant and a $13.9 million decrease for moving costs for DHS headquarters relocation. The change under the Montgomery County block grant is described more in the text on page 9 of the report. Under current state law, Montgomery County receives a block grant for the operation of its child welfare, adult services, family investment, and administrative expenditures rather than operating under the local Department of Social Services model, similar to other jurisdictions in the state. The $13 million decrease for that block grant for Montgomery County is significantly larger than the year-over-year change in recent fiscal years. So the analysis is asking the department to comment on some of the specific reasons for that change, especially since there are centrally budgeted cost allocations for statewide personnel increases in both 2024 and 2025 that would impact that change. Turning next to page 10 of the analysis, this gives a summary of some of the caseload assumptions for areas of the DHS budget that are based on caseloads. First of all, under cash assistance, there's an 8% decrease assumed for temporary cash assistance caseloads. Corresponding to that, there's a 53% increase for TCA transitional benefits. There's a 6% increase estimated for the temporary disability assistance payment program. The SNAP supplemental benefit program is estimated to stay at the same level, and the federal SNAP cases are anticipated to increase by 3%. Under child welfare caseloads, foster care caseloads are anticipated to decline by 2%. Subsidized adoption and guardianship caseloads are anticipated to decrease by 1%. And the total amount of collections for child support in the budget are anticipated to increase by approximately 5%. On page 11 is a summary of personnel data for the department. And as shown in this chart, there is no net change in the fiscal 2025 budget for the total number of regular or contractual positions. The next section, the analysis covers four main issues for discussion. The first issue I'd like to discuss is more on personnel vacancies and personnel recruitment and retention. In recent fiscal years, DHS has been identified as having relatively high levels of personnel vacancies in comparison to other state agencies. However, the statewide personnel system data available as of December 1st, 2023 shows that the department-wide vacancy rate declined by approximately 5 percentage points compared to December 1st of 2022 from about 14.9% to about 9.9%. In exhibit number 1 on page 13, this is providing data on the number of total filled positions compared to total positions authorized. This 9.9% vacancy rate equates to about a 90.1% total percent of filled positions. Among individual administrations within DHS, the highest percent of filled positions by administration was in the Family Investment Administration, which had 92.6% of positions filled. The lowest percent was in the Social Services Administration, which had 87.5% of positions filled. The highest year-over-year increase was in the Family Investment Administration, and department-wide, the increase of 5% in total filled positions equates to about a net increase of an additional 306 positions filled as of December 1st, 2023 compared to the prior year. The next exhibit 2 on page 14 is providing data on vacancies by the length of time that positions have been vacant. As of December 1st, 2023, there were a total of about 592 vacant positions department-wide. Of these, approximately 191, or about 32.3%, were long-term vacancies vacant for over 1 year. A total of about 265 positions were positions that had been vacant for 6 months or less, or approximately 44.9% of total vacancies. Exhibit 3 on page 15 is providing data reported by DHS on vacancies by specific position classifications. These are the 5 position classifications that had the highest percentage of positions within those classifications vacant. The highest being the casework specialist family services position, which had 26.9% of positions within that position classification vacant. That position, along with the family services caseworker trainee position, are both social worker positions within the Social Services Administration, which, as I just mentioned, had the highest share of total department-wide vacancies. The other 3 position classifications with the highest rate of position vacancies include the child support specialist and child support specialist trainee positions, as well as the family investment specialist position. Turning to exhibit 4 on page 16, DHS was also asked to provide data on salary ranges for those 5 position classifications in comparison to comparable positions in the states of Delaware, Pennsylvania, and Virginia. Due to the analysis that DHS put together, they found that the starting salaries for DHS positions were comparably higher compared to the comparable positions in the other 3 states, except for 3 out of 5 positions in Pennsylvania, which had higher starting salaries. However, the upper limit to the salary ranges differed among states. In the 5 positions in Pennsylvania that were surveyed, 4 out of 5 of those positions had higher salary upper limits compared to the DHS positions. In the 5 positions in Virginia that were surveyed, 1 position had a higher upper salary limit. In the state of Delaware, the 5 positions that were surveyed had lower both starting salaries and upper salary scale limits than compared to the DHS positions. DHS notes that in the states of Virginia and Pennsylvania, there are also different requirements for licensure for working as a social worker, which may also impact salary ranges in those states to some degree. The remainder of this section of the report discusses some of the components of the DHS department-wide recruitment and retention strategy, as well as some of the activities related to recruitment and retention it underwent over the previous calendar year. These include deepening the pool of potential candidates and removing barriers of entry for positions, streamlining the recruitment process, marketing the department as an employer of choice, focusing on competitive compensation and employee work environments, focusing on balancing departmental needs with employee well-being. Some of these strategies are compatible with strategies outlined by the Department of Budget and Management in the task force on the modernization of state personnel management system on needs, which met during the 2023 interim and has been outlined in the report on personnel by DBM. DHS reported that during calendar 2023, it engaged in a variety of both in-person and virtual recruitment efforts, including participating in approximately 13 job fairs during that time period. That concludes that section of the analysis. I'm next going to turn over the discussion to Tanya, who's going to be presenting the temporary assistance to needy families update.
So if you turn to page 18, this begins the update on the TANF balance and spending. The uses of TANF are outlined in a federal law, and they must meet one of four purposes: providing assistance to needy families, reducing the dependence of needy families by promoting job preparation work and marriage, preventing and reducing out-of-wedlock pregnancies, and encouraging the formation and maintenance of two-parent families. The funding through the TANF is primarily provided through a block grant, which is largely unchanged since the program's initiation. Since fiscal 2017, Maryland has received approximately $228 million through the block grant each year. Maryland has also received TANF contingency funds each year since the Great Recession. Contingency funds are available to states meeting certain criteria related to the SNAP participation or unemployment, which are shown in the bullets on that page. The state continues to qualify for the contingency funds based on the second bullet, which is related to the SNAP caseload increases are being higher than they were in a comparable period in the mid-90s. The state has received in fiscal 2023 about $27 million through the contingency funds and expects us to receive the same level in fiscal 2024 and 2025. Between fiscal 2021 and 2022, the state replaced $140 million of planned TANF spending on cash assistance with state fiscal recovery funds available through the American Rescue Plan Act. The purpose of this was intended to assist the state with a higher than expected temporary cash assistance caseload and allow the state to retain the balance for future years. So there were higher general fund spending that at that time, but it would reduce general fund spending at a future time when general funds would be less available, and there would be a balance available to be used. The ending fund balance in fiscal 2022 was $63.5 million, which was about $23 million higher than fiscal 2019 due to this fund swap, but it was about half the balance that was expected when this fund swap occurred. As shown in Exhibit 5, the balance at the close of fiscal 2023 was $47 million, a decrease of about $16 million compared to fiscal 2022, primarily due to increases in expenditures. DLS notes that this was a larger decrease than was expected during the 2023 session and came at a time when general funds remained plentiful. So that reduces the fund balance in years when general funds are less plentiful, like they are now. DHS anticipates a closing balance in fiscal 2025 of about $36 million due to increased TANF spending compared to fiscal 2024. Exhibit 6 on page 21 shows the spending of TANF, the TANF block grant by purpose for fiscal 2022, 23, 24, and 25. For 23, it also compares the spending as it was known during session last year compared to what actually happened. And this illustrates why the balance ended up being lower than what was expected during session. The actual expenditures were about $5 million higher than was expected. This increase primarily occurred in child welfare services and the local family investment program, partially offset by decreases in cash assistance due to lower caseloads, and the work opportunities program due to reduced employment and training activity since the onset of COVID. In fiscal 2025, spending is budgeted at about $17 million higher than fiscal 2024. The main area of increase is in the foster care maintenance payments program. It's an increase of about $18 million. The level of spending budgeted for foster care maintenance from TANF of about $34.7 million in fiscal 2025 is the second highest in recent history. There's also an increase of about $6.3 million in the local family investment program, which brings it more in line with the fiscal 2023 actual experience. There is a decline in the funding for the work opportunities program. It would still be an increase over fiscal 2023, but I would note that the fiscal 2023 spending was the second lowest since at least, or was the lowest since at least fiscal 2023, and fiscal 2025 would be the second lowest. If you turn to page 22, Exhibit 7 provides information on the share of the TANF spending that is for cash assistance. It's generally around 42 to 44%. If this was lower in fiscal 2021 and 22, but that is related to the plan swap that I discussed earlier. Exhibit 8 on page 23 presents information on the TANF spending for child welfare purposes. As shown in this exhibit, since fiscal 2020, DHS has spent more than $30 million of TANF on child welfare services in each year, compared to less than $20 million in the 4 years prior to that. DHS last session indicated that this was due to declining attainment and other fund sources, including the Title IV program, which is the primary federal fund source for child welfare and foster care. DLS notes that in these years with the higher spending on child welfare, the budget is introduced generally included lower funding from TANF for these purposes. So for example, in fiscal 2022, the actual spending turned out to be $41.5 million from TANF, but there was slightly less than $25 million in the budget as it was introduced. The increased use of TANF at closeout for child welfare services highlights potential risks in the balance for fiscal 24 and 25 in terms of the ending fund balance, because the amounts budgeted, as you can see in this exhibit, are similar to the lower levels they had budgeted in prior years, even though the actual expenditures had been much higher. Similarly, spending on foster care maintenance payments has increased substantially since fiscal 2015, when it totaled less than $7 million. In fiscal 2020 through 2023, the spending was more than $30 million from the foster care maintenance payments. In fiscal 2015, these programs combined to represent about 9.3% of TANF spending, but it exceeded 25% in each of the three most recent actual expenditures. Beginning on page 24 is a discussion of the maintenance of effort. The state must meet certain levels of spending of its own money due to the receipt of the block grant and to continue to be eligible for contingency funds. The state more than meets these requirements. The largest source of maintenance of effort spending are the earned income tax credits, both the state and local share. These alone were more than sufficient to meet the requirements in fiscal 22 and 23. Other significant contributors in fiscal 23 are the pre-kindergarten spending and cash assistance. Beginning at the bottom of page 24 is a discussion of a notice of proposed rulemaking related to TANF spending and MOE claiming that was released in October 23 by the U.S. Department of Health and Human Services Administration for Children and Family. ACF indicated in this notice that they had noticed that states were shifting spending away from focusing on direct cash assistance and employment-related spending, and that spending was occurring for families with higher income levels and on purposes it viewed as tenuously connected to the four purposes of TANF. It proposed several major changes in the rulemaking about the allowable uses, and those are shown in the bullets beginning on the bottom of page 24 and continuing on to 25. I'm going to focus on the two on the bottom of page 24. It would establish a maximum income for the state definition of needy at 200% of the federal poverty level. Previously, there was no such definition for that term, and so states could define their own terms. And it would also establish in regulation a standard for determining acceptable uses of funds. In this rulemaking, they didn't expressly state what would be allowed or disallowed uses of the funds for the purposes, but it provided examples of things that can be likely allowed or not likely not allowed. And those are shown in Exhibit 9 on pages 25 and 26. I'm just going to highlight the one on page 25 related to providing assistance to needy families. In the likely not allowed category are certain child welfare costs, including foster care or out-of-home maintenance payments and child protective investigations. DHS reports that it is opposed to the proposed changes in the regulations, and they report that changing the limit on the definition of needy families would impact certain spending and claiming of a MOE by the department. It uses the definition of needy for some spending that is 300% of federal poverty, particularly in the areas of child welfare, transitional benefits, and pre-kindergarten programs. Pre-kindergarten programs is only related to maintenance of effort spending. TANF spending does not occur outside of the department. In fiscal 23, the department claimed about $187 million from the pre-K programs for the maintenance of effort. The spending, as I noted, on foster care maintenance payments and child welfare services has substantially increased in recent years and combined to be over $70 million in each of the three most recent fiscal years. DHS indicates that the spending in this area is primarily for adoption and guardianship subsidies, as well as child welfare services, caseworker activities related to in-home services. DLS is concerned that the spending in this area would not meet the definition of the reasonableness test, and there would be two impacts of that failure to meet the standard. Initially, there would be a risk of a penalty if it was deemed a misuse of funds, and the second, other fund sources would be needed to replace that spending. DLS notes that one solution would be to shift more of the TANF spending currently programmed on TCA to on other programs to TCA, which would free up general funds to then move to other programs like child welfare services and foster care maintenance payments. And we'll make a recommendation to allow for this flexibility in the Family Investment Administration analysis. And we've also asked the department to discuss the status of the proposed rulemaking and any timeframe for the regulations being implemented and any impacts on the general fund from this. And I'll turn it back over to Sam.
Thank you, Tana. The third issue that's covered in the analysis is related to hospital stays and hospital overstays for children and youth and out-of-home care through DHS. Hospital overstays occur due to delays in securing appropriate placements with providers for children with complex behavioral health or physical health needs, and result in children remaining in the hospital for longer than is medically necessary. Hospital overstays are impacted by both the lack of adequate provider capacity and the number and types of in-state providers necessary to meet the complex needs of these youth. In order to track the extent of this issue in Maryland, the budget committees in recent years have asked DHS, and DHS has provided data on the number of emergency room visits, inpatient hospital stays, hospital overstays, as well as placements after discharge for these stays. The current data for the current reporting period that DHS submitted in December covers the period of October of 2022 to September of 2023. Exhibit number 10 on page 29 is showing the number of emergency room visits as well as the average length of stay for those emergency room visits. During the current reporting period, there were a total of 205 emergency room visits by children in out-of-home care through DHS. This is an increase of about 55 emergency room visits in total compared to the current period. An increase of 55 in the current reporting period compared to the prior reporting period, which spanned the period from October of 2021 through September of 2022. These ranged from a low of by month from 6 to a high of 29. And for all of these emergency room visits, the average length of stay during the current reporting period was approximately 8.4 days, which by month ranged from a low of 2.7 days to a high of 24 days. Comparatively, in the prior reporting period, the average length of stay for emergency room visits was 16.9 days. So the current reporting period data shows a decrease of approximately 8.5 days. The next exhibit, exhibit 11 on page 30, is showing data on the number of inpatient medical and psychiatric hospitalizations, as well as the average length of stay for these hospitalizations. In the current reporting period, there were 159 medical hospital admissions and 196 psychiatric hospital admissions. Similar to the number of emergency room visits, the number of hospital admissions in both categories decreased in the current reporting period compared to the prior reporting period. The average length of stay for these hospital admissions was 20.1 days for medical hospitalizations and 27.6 days for psychiatric hospitalizations. These average length of stay are decreases comparatively to the prior reporting period. In the prior reporting period, the average length of stay was 32.4 days for medical hospitalizations and 33.7 for psychiatric hospitalizations. The next exhibit on page number 31 shows the data specifically for the hospital overstays. Between October 2022 and September 2023, there was a total of 99 hospital overstays. Within this total, 15 were for medical reasons and 84 were for psychiatric reasons. Among medical overstays, the average length of the overstay was 32.3 days. Among psychiatric overstays, the average length was 38.8 days. Comparatively to the data previously reported for the prior reporting period, the length of medical overstays decreased by 4.1 days. However, the length of psychiatric overstays increased by approximately 5.5 days. Exhibit 13 on page 33 shows data on the placements after discharge for inpatient medical and psychiatric hospitalizations. There were a total of 355 children that were served in hospitals during 2023. However, due to some children having multiple hospital stays, the total number of discharges shown in Exhibit 13 is 608. Exhibit 13 shows that the most common placement types after discharge were in residential group home providers and private treatment foster care providers. The remainder of the data in this section of the report comes from the annual out-of-home placement report that is submitted by the Governor's Office of Crime Prevention, Youth and Victim Services on behalf of the Children's Cabinet agencies. I'd like to highlight in the report, Exhibit 14 is showing data on providers as reported by GOCPYVS. And doing a comparison of the data provided in the 2022 report and the 2023 report, the total number of providers decreased by about 18 from 170 in 2022 to 152 in 2023. The average total capacity for those providers also decreased by about 34.29 from a capacity of 410.48 in 2022 to 376.19 in 2023. In the 2023 annual report, GOC-PYVS outlines some of the actions that both DHS, the Maryland Department of Health, Behavioral Health Administration, and other child-serving agencies have undergone in 2023 and plan to undergo in 2024 in order to address some of the service gaps for community-based and residential services for Maryland children and youth. Among these, DHS engaged in weekly interagency meetings with other agencies, dedicated specific staff resources and staff to work directly with hospitals and providers, and work to continue the implementation of community-based services under the Family First Prevention Services Act in order to work to prevent the need for higher level services in some instances. The Maryland Department of Health Behavioral Health Institute specifically worked to build out additional bed capacity in some of the residential treatment centers that it operates. BHA also worked to develop an inpatient bed registry to better identify available inpatient beds, as well as engaging in ongoing work with Medicaid-funded residential treatment center providers in efforts to realign Medicaid base rates for these providers to develop a tiered rate structure. More broadly, MDH, DHS, and other child service agencies continue to work towards the more broad efforts for rate reform across child care providers. The fourth and final issue that's covered in the report is summarizing some of the updates from the Life After Welfare 2023 annual report, which is published by the University of Maryland School of Social Work, and reports on some of the outcomes for families as they exit the TCA program. The 2023 report update broke families exiting TCA into 3 different individual cohorts in order to specifically identify some of the impacts that families leaving the program during the height of the COVID-19 pandemic, how the characteristics of the COVID-19 pandemic impacted those families after exit. Exhibit 15 on page 37 is showing that the report found that among the pandemic cohort, which were families exiting TCA between April 2020 and December of 2021, about 56% of those families were first-time recipients of the TCA program, which is a comparatively higher number than TCA exiters during other time periods. This is reflective of some of the wide-going economic challenges brought about by the pandemic, which resulted in additional new families participating in TCA. The TCA participants during the pandemic period were found to have much more diverse gender, ethnicity, race, age, geographic distribution, and educational attainment levels compared to TCA participants across all time periods. These differences in characteristics are reflective in the next 2 exhibits, which show data on changes in employment percentages as well as earning percentages in both the time period prior to TCA participation and after TCA participation. Exhibit 16 on page 38 is showing changes in employment percentages. Generally, there's a higher rate of employment percentage following TCA percentage compared to prior to TCA percentage. However, as shown under the pandemic cohort, during the height of the pandemic, this trend actually reversed, and families exiting between April 2020 and December 2021 actually showed a slight decrease in employment percentages following participation compared to prior to participation, reflective of some of the ongoing challenges caused by economic conditions during the height of the COVID-19 pandemic for finding and maintaining ongoing employment. Exhibit 17 showing similar data for earnings. during the pandemic cohort, during the height of the pandemic, the key change here is that the pandemic cohort had a lower overall increase in earning amounts between prior to participation and following participation. This was caused by the fact that the pandemic cohort had initially higher earnings levels prior to participation compared to the overall sample size due to some of the differences in educational attainment levels and other changes in demographic characteristics. Exhibit 18 shows data on the participation in other assistance programs in the year following TCA exit. This data shows that specifically for the SNAP program, there was a high rate of participation. About 86% of families received SNAP benefits in the year after TCA exit. Some of the other programs, specifically the Supplemental Security Income Program and the Temporary Support Services Program, had lower rates of participation in the year following TCA exit, but still totaled about 14% for SSI and 24% for TSS. This data reflects that following TCA exit, even families that are able to maintain ongoing employment are still faced with low overall earnings levels that require participation in other benefit programs. The last chart, Exhibit 19, is showing the percentage of families returning to TCA after exit by the length of break in participation. Overall, families that exited TCA within 1 year of exit, approximately 16% of families ultimately returned to TCA during that time period. As the time went on, the percentage of families returning to TCA decreased over time. Within the 1 to 2 year time frame after exiting, about 6% returned to participation. Between 2 to 3 years, 4% return to participation, and decreasing percentages on from there. That will conclude the DLS presentation there, and we're available to answer any questions. Thank you.
Thank you, Mr. Quist. Thank you, Ms. Zimmerman. Are there any questions from the committee? Seeing none, I'll bring up Secretary Lopez and his team.
Enough. There we go. Good afternoon, everybody. Happy session. Chairman McCray and members of the subcommittee, I am Rafael Lopez, and I serve as the Secretary of the Department of Human Services. I'd like to thank Governor Moore, Lieutenant Governor Miller, our colleagues at the Department of Budget and Management, and the budget committees for their support. We are grateful to the Department of Legislative Services analyst, Sam Quist, for his budget analysis and hearing us repeat this multiple times. Joining me at the table today are, to my right, Principal Deputy Secretary Carnita White, and to my left, Acting Chief Financial Officer Kirill Resnick. We have senior members of our team also in attendance here today: Chief of Staff Webster Yee, Assistant Secretary for Policy Heather Zanoni, Director of the Baltimore City Department of Social Services Brandy Stocksdale, Director of the Baltimore County Department of Social Services Mark Millspa, Executive Director of the Child Support Administration Kevin Geistwhite, Acting Executive Director of the Family Investment Administration, Augustin and Tawagani Yamana. Our new Executive Director, we just realized is not here, but I should say, that's the orientation. We have just announced that Dr. Aldra Studstill is the new Executive Director of the Social Services Administration, and his first day in service to the people of Maryland was yesterday. We serve at DHS to empower every Marylander to reach their full potential by providing preventative and supportive services, economic assistance, and meaningful connections to work and career opportunities. We are committed to unlocking opportunities for the over 1 million Marylanders we serve each year. We work in partnership with nearly 6,000 members of our team across all 24 jurisdictions and departments of social services. Together, we administer a $4.1 billion budget that is 73% federally funded. Governor Moore charges to be fiscally responsible while prioritizing essential investments to rebuild the Maryland state government. We're using a data-driven approach to prioritize our investments to help grow our economy in the long term and to better serve Marylanders. For too long, there was a failure to make critical investments in DHS to truly make Maryland a place where we leave no one behind. I'd like to now highlight 3 key areas in our proposed budget before you this afternoon that highlight our department's contributions to, number 1, ending childhood poverty, 2, launching a new era of child welfare in the state, and 3, reimagining MD Think. So first, on the issue of ending childhood poverty. I was like, oh, that's weird. The microphone was moving, my apologies. So first, I want to turn your attention to the work of our team in reimbursing stolen benefits. Pleas by Marylanders for help went unanswered for far too long, and this administration is ensuring that Marylanders receive the benefits they need. We work closely with the legislature, advocates, and victims of benefit theft to be the first state in the nation to create from scratch a simple, seamless, and swift way to replace over $19 million in stolen benefits to over 30,000 households as of this morning. We use data to drive our decision-making, and direct assistance to families is proven to lift people out of poverty, and families were denied that assistance because of thieves. They deserved better. In this challenging political environment in a presidential election year, we are concerned that the federal government will not renew its stolen SNAP replacement program in the Farm Bill. We have worked closely with the Maryland federal delegation to brief them twice in person and continue to partner with them to stress the importance of including in a future Farm Bill federal money to partner with states like Maryland to not only replace stolen benefits, but also to have a secured source of funding to prevent the further theft of stolen benefits. To be proactive and move with urgency, we are working with the bill sponsors of last year's Senate Bill 2, House Bill 502, to course correct and improve safeguards for Maryland's investments. In addition, we are also trying to be innovative around our approach to summer SNAP. With your partnership, 500,000 children in Maryland will be fed every summer when they're not in school. By investing $9 million in state general funds for our share of program administration, Maryland will receive from the federal government an additional $9 million for administrative costs and $60 million for food benefits. This investment is proposed in Governor Moore's budget as a $78 million investment in the children and families of Maryland. Together, we will help families feed their children in all 24 jurisdictions across Maryland beginning in June of this year. When the state summer SNAP program launched in 2019, we served 3,923 children in only 4 jurisdictions. During the summer of 2023, we served 90,571 children in 14 jurisdictions. This is important and a step in the right direction. The reason not all jurisdictions opted into the summer SNAP program is due to a lack of funds and bureaucratic barriers in the opt-in process. By innovatively and seamlessly implementing the federal summer EBT program, we will help feed 500,000 children across Maryland in every single one of its jurisdictions, including the approximately 60% of eligible children who rely on free or reduced lunch, but are not participating in SNAP at this time. Now I'd like to focus on turning our attention to child welfare specifically and launching a new era of child welfare in the state of Maryland, where we are focusing on family. Specifically, I want to speak to the issue of preventing unnecessary removals for families across the state. 2, ending aging out in the state. 3, creating a kin first culture in the state. And 4, rate reform in the state. So first, the Family First Prevention Services is an act passed by federal law several years ago. And its intention was to prevent the unnecessary removals and leverage federal money to do it effectively. We are committed to providing family-centered, child-focused, community-based services that promote safety and well-being and strengthens families. We will lead efforts to leverage additional federal funding to support innovative foster care prevention services for Marylanders. For many years, DHS did not draw down tens of millions of dollars in available federal funding to expand services for families in crisis. Early in our administration, we partnered with the Annie E. Casey Foundation and Casey Family Programs to implement best practices to help us actually participate in the Federal Family First Prevention Services Act. In 2018, FFPSA, as the acronym is known, authorized states like Maryland to use federal uncapped entitlement funds for time-limited foster care prevention services. The goal of Family First is to prevent unnecessary foster care placements by proactively addressing the top 3 reasons children enter foster care, whether in Maryland or across the country. And those are 1, substance use disorders, 2, mental health, and 3, challenges with parenting. Maryland has not seized the day because DHS has not drawn down a single dollar in federal funds for prevention services, not one. In addition, DHS could increase its Title IV foster care administrative revenue by at least $1 million a quarter or $4 million per year, while drawing down federal funds for innovative services that prevent foster care in the first place and keep Maryland families safely together. To draw down more federal funds, we will improve how we identify children who are eligible for federal 4E funds when out-of-home placements are in fact necessary. For example, we recently discovered that there are 1,508 pending 4E determinations in the state of Maryland. About 790 of those pending have been in process for more than a year and still pending because DHS did not have a structure in place to make sure we were accountable for those kinds of federal fund drawdowns. If just half of the pending determinations are completed, the federal share of our costs would increase by 5+%. This is the first step of what we think we can do to responsibly invest the Maryland taxpayers' dollars and leverage every single available federal resource to help stretch general fund dollars to better serve children and their families. Now, I'd like to turn our attention to number 2, which I spoke of regarding ending aging out in the state of Maryland. Despite reducing entries into foster care over the last 10 years, 64% of youth aged out of Maryland in foster care in fiscal year 2021. Twice as many older youth age out of foster care in Maryland as compared to the entire nation's data. In Maryland, teens are 40% less likely to reunify with family as compared to national data. And as you can imagine, connection to one's family by blood or by choice matters, whether 18, 19, 20, or 21. In the end, family matters. Non-Hispanic African-American girls are disproportionately aging out of foster care in Maryland because African-American teen girls enter foster care in Maryland at higher rates and are less frequently reunified with their family. This is unacceptable, and we must act with a new kind of urgency across the state. Implementing Family First is the first step to reducing the number of African-American teen girls entering care. The next step is to ensure that teens are placed with kin by creating a kin-first culture, not just in the Department of Human Services, but across the state. And that turns us to our third point around the new era of welfare, child welfare reform, which is about the kin-first culture. When children can't safely remain at home, both research and common sense tells us that out-of-home placements with kin, biological and chosen, is in fact in a child's best interest. Best practice and research reminds Maryland that placement with kin increases stability, results in better mental and physical health outcomes, reduces the risk that foster youth will be trafficked, and keeps children connected to family, community, and culture. By creating a kin-first culture, we seek to improve outcomes for children and families and reduce family separation in the first place. Currently, only 23% of all children in foster care in Maryland are placed with kin. That's a step in the right direction, but we can do so much more. Maryland has significant opportunities to increase kinship placements, improve support for kin families, and improve kinship guardianship permanency outcomes. We are working with the chairs of the judicial committees this session to bring our kin-first proposals to the table for further consideration, given welcome changes in federal rules on how we can all better support kin. Just before this meeting, our team was speaking at an event where family advocates were gathered. And one of the things we raised was the importance of supporting families when they're supporting their families around kin. So for example, the chairman of that particular board is an alumnus of foster care. And he actually took care of his brothers and sisters. But as of today, that would have been against the law in Maryland. You'd have to be 21 years of age or older. But if you are 18 or 19 or 20 or 21 and are capable and want to care for your brothers or sisters or your kin, the changes and rules we are proposing both federally and in the state of Maryland allows that to do that. We should be in a position as a state to do all that we can to keep our kids with kin. Finally, the fourth item related to rate reform. DHS squandered many years of opportunities to modernize our regulatory framework to create a continuum of care that better meets the needs of the state's children and families. For more than a decade, Maryland has steadily and dramatically reduced the number of children in out-of-home care while protecting child safety. In fact, new entries are down 38% across the state since fiscal year 2017. That's great news. However, youth that do require out-of-home placement often present with more complex symptoms and clinical needs. With the corresponding national decline in group-based placements, we must be ever more vigilant to ensure youth receive in-state treatment services rather than simply assume that an out-of-state placement is our only option for the state. Maryland has experienced over a decade of failed attempts to reform its child placement provider rate setting to align with the actual cost of care, provide flexibility for specialized services, and capitalize on federal funding. And we're making sure this happens, this change happens together with you. With the implementation of rate reform, we project the opportunity to draw down at least $10.5 million in federal funding for direct care costs and $7.6 million in Medicaid reimbursement for clinical services. The governor's budget proposes a $27 million investment in this reform effort. And as noted, it is likely to have a substantive positive impact on the lives of Maryland's children. DHS and our child-serving sister agencies like the Maryland Department of Health and the Department of Juvenile Services will continue to work with the General Assembly on common sense and much-needed regulatory reform to ensure that we bring greater consistency and transparency to child welfare services. Now I'd like to turn our attention to MD Think. Of the many gifts that we receive in this administration, MD Think is something that we've spent more time on than I think any of us have imagined. MD Think, by way of context, is a shared technology platform that began in February of 2016 to modernize and integrate multiple state health and human services programs and applications across the state. MD Think serves as the state's benefits platform to ensure Marylanders can access the help and services they need, such as health insurance and food. Since assuming office last year, we have been examining MD Think's operations, which has revealed significant issues. To put it simply, MD Think's applications have not been working as they should, or as was told to you, and whether for our customers or the thousands of state team members who use it to do their jobs and serve the people, it's simply not working. That said, we have been working closely with my colleague, Secretary of Health, Herrera Scott, and Secretary of the Department of Information Technology, or DO-IT, Katie Savage, and we have found a lack of oversight and financial overspend that we quickly began to course correct and began doing so much more publicly and in a transparent way. No cost savings were achieved through federal fiscal year 2022, and MD Think has spent approximately $216 million more than anticipated on the MD Think platform to date. That was as of last fall. Upon discovering these issues, together with our colleagues, we responded with immediate and decisive actions, including key leadership changes to ensure responsible oversight of MD Think's daily operations, including the appointment of a new executive director, Pat McLaughlin, and rebuilding his entire leadership team. We have reduced a projected budget shortfall in state fiscal year 2023 to less than $6 million. MD Think overspent in federal fiscal year 2022 by over $73 million. We have also halted the creation of new development and application migration efforts to focus on existing applications and making sure those work. We have increased accountability across the board around the authorization of new expenditures, required project budgets, and other basic administrative safeguards. It's worth repeating that we required the authorization of new expenditures and project budgets, which did not exist in writing for any of the projects we inherited. We intentionally visited our team members in every jurisdiction, as well as our customers across the state. We listened and we acted accordingly. We are partnering with Code for America to help us rapidly prototype new ways to engage the customers we serve in a more engaging and mobile-friendly way. Put frankly, MD Think was developed for laptops and computers, not for mobile-friendly access. Most people in this country, including in Maryland, use their phones to access services. It was not built or designed for that. Finally, as part of our effort to rebuild state government, and specifically to rebuild the Department of Human Services, like MD Think, we inherited a deeply broken department. We have spent the past year moving with great urgency to course correct and rebuild with ever increasing transparency and accountability. We are holding ourselves accountable to a new level of excellence. Last year, we decreased straight job vacancies by 5.5%, from 15.20% on January 1st of 2023 to 9.69% on December 31st, 2023. That did not happen by accident. And with the addition of a new statewide customer call center in 2024, we are determined to create a workplace culture where world-class customer service is the new normal for for the Department of Human Services and for Marylanders who should be treated with the respect and dignity they deserve. This budget proposal was assembled in partnership with many of you and others who advocate tirelessly for the Marylanders we serve. We are ready to work with you to deliver bold investments in a fiscally responsible way to make this Maryland's decade. With that said, I'll turn it over to our Acting Chief Financial Officer, Kirill Resnick, who's going to respond briefly to summarize our responses to the DLS analysis. Kirill.
Thank you, Mr. Secretary. Thank you, members of the Subcommittee of Budget and Tax, Senator McCray and members. It's good to see all of you again. To respond to the questions posed within the analysis, first, I'd like to address the issue of the decrease in funding for the Montgomery County Block Grant. So in 2022, during the planning process for the FY24 budget, the DHS Office of Budget and Finance made an error in providing Montgomery County an additional $4 million for FY23 and $9.4 million in FY24 for a total of $13.4 million. This was not meant to be an increase. During the budget formulation process, the general funds were increased with the assumption that federal funds would be decreased. Unfortunately, the federal funds never got decreased in their allotment, and as a result, it was showing as an increase of $13.4 million. When this error was discovered earlier this year, we immediately sent a letter to Montgomery County HHS. That letter, a copy of that letter is in your testimony, telling them to not spend that money and that it will be reverted. So that is exactly what happened. And this year's allotment, though it appears to be a decrease, is in fact in line with funding from years prior to when the error was made. It's a bit of a clarification. Earlier, we received this question in a different form from DLS. We had originally assumed, based on the information we had at the time, that it was actually excess ARPA funds that were being spent down instead. That was an error, and we're correcting it here. So we obviously apologize for that mistake at the time. In discussing the risk to shifting TANF spending as a result of potentially proposed rulemaking from ACF, from the Administration of Children and Families, as stated in the analysis, DHS strongly disagrees with that rule change that would limit our ability to provide critically needed help to Marylanders. At this time, the risk of this rule being implemented by the federal government in the near term, is actually relatively low. Any rule that is perceived to reduce state flexibility or limit benefits promulgated in an election year will have political consequences rulemakers are likely to avoid in the coming year. In addition, any unpopular rule like that is also subject to congressional review. Creating income insecurity for families is an effective primary prevention strategy in avoiding child abuse and neglect, as poverty is a documented risk factor for that abuse and neglect. As a result, stabilizing household income saves money in the long run. Utilizing resources for primary prevention strategies rather than treating an avoidable problem is the best course of action. Because of these reasons, we believe that the risk to Maryland at this time is limited, and shifting state resources away from needed programs and spending in a year where decreased revenue is expected to cover a potential change in federal regulation that may not materialize is not something that we think is prudent at this time. And the follow-up question to the same general topic of what we anticipate the time frame is for this new rulemaking out of ACF. We believe that the federal government has not provided a specific time frame for implementing this notice of proposed rulemaking. And as mentioned in the previous comment, we do not anticipate implementation in the short term. DHS commented on the proposed regulation on December 1st, in which we identified that federal statutory language does not authorize administratively reduced state flexibility. That response is also in your testimony that we have provided, and you are free to read our comments. We are hopeful that the key provisions in the proposed rule that DHS disagrees with will be amended before the final rule is promulgated. Under the current state plan, we provide TANF services to households with income levels of up to $300 of poverty. I'm sorry, 300% of poverty. Under this proposed rule, that would be limited to, we would be stepped back to 200%, which would impact cash assistance, but it would also limit access to other services, especially child welfare spending, transition benefits, and diversion programs. The potential federal limitations would require significant allocation of general funds, which we don't even have the answer to at the moment. We are working to calculate what that impact would be, or it would require a change in state law mandating a lower eligibility at 200%. Considering that HCF has not yet promulgated a final rule nor established an effective date, DHS has not yet assessed the rule's impact on the state's ability to meet the required maintenance of effort. The department will make that assessment once we have a better sense of when that rule will take effect and what that rule will actually look like when finalized. So with that, thank you for your attention, and with the secretary and others, we're open to your questions.
Well, thank you. At this time, we'll open up for questions. I'll start off with two. One of them is in reference to just the food banks. Typically, it switches back and forth. Sometimes it's in DHS, sometimes it's in dedicated purpose account. This year is not in the dedicated purpose account. Just want to confirm that it is in DHS's.
So we can't speak to directly individual organizations who might receive grants. I can tell you that we have received a budget allocation from the governor in his allowance for up to $19 million for the Office of Grant Management within DHS. Specific programs within there we cannot speak to directly, but we believe that it is on par with previous years, if frankly not higher than previous years. We are confident that we will be able to work with similar organizations as we have in the past.
Perfect. The second question, if you all can comment on the extra $45 that was given to TCA and TDET back since 2020 and ongoing.
Certainly.
Sure. For the record, I'm Carnitra White, and I serve as Principal Deputy Secretary for the department. Good afternoon, Chairman and members of the committee. Glad to be here with you today. To answer your question, Senator, we have looking and confirming. We believe that our benefits are going to be level set, but we're confirming all of the benefits with that, and we're happy to get back to you with the specifics after we scrape the budget and make sure that it is there. But all intentions, it looks like that our benefits are level set from last year.
Perfect. Senator Hedelman.
Very much, Mr. Chairman. And thank you for your presentation. And it's certainly really, really good to hear about SNAP. And we have many hungry children around our state. So it's really good to see that growth, and it is very much needed. And I want to say hi to Mr. Millspaugh from Baltimore County. Good to see you. I have two questions for you, one of which is following up on something from last year, and I don't think it's going to be a surprise, which was the $60 benefit that families get under TCA when they reside in subsidized housing, eliminating the practice of reducing their benefit because of that. And I know we had talked and had the impression that there would be a way to work through that during the interim. So I would just love an update on that.
Sure. The quick answer is we certainly are open to that on the table in terms of all of our benefits packages, much the way the principal deputy responded. We had to take a look at all of our benefits, and our number one priority this year was actually spending and making sure that we replace stolen benefits. So we are right now, I would say, in a retroactive period still. The work to launch that from scratch and to actually course correct it both in law this year is our number one priority. We actually are going to take a little bit more time than we thought to untangle the way in which SNAP and TANF benefits are used writ large across the Department of Human Services, and are considering all options, including pass-throughs and a variety of other options that we are working with partners and others on. So we don't have a change this year to report out, but that's certainly an option on the table moving forward.
Okay. And if I could ask one more thing, and I do also want to, commend you being the first in the nation and crafting that new program and making it successful and getting people reimbursed who had funds stolen is, definitely top of the list. And so you deserve accolades for getting that done. So thank you. I have to say, and my former colleague in the House who's sitting next to you, this was an issue that was very important to him too, I think, and that is stays in hospitals and other settings. I have heard rumblings that there might be policy changes in people who are put up in hotels temporarily, and just wanted to inquire about that. Yes. And if that is going to be a policy change, what the backstop will be to address the needs of those real challenged kids.
So I'm happy to speak this. I'm actually glad you asked the question. And if you noticed in what we chose to highlight, there are many things that the Department of Human Services does. But one of the things that we are trying to do is to put an end to sort of policy by myth at the Department of Human Services and the state of Maryland on this issue. So I want to speak on the record about some of these things. So first of all, I've been stunned in this year how many people reach out to me and our entire team here with completely inaccurate facts. So on the record, I want to say today that there are 3,799 children in the care and custody of the state of Maryland. We are now tracking in a much more religious and disciplined way every single day their ages, where they are, how long they've been there, and what is happening. That should have been something that we inherited. We should not have created from scratch the spreadsheet from which I'm looking at. I could tell you now exactly by county where kids are and why. It wasn't that we didn't have the data at all. We drown in data across the state. It's how do you extract it and use it to drive your strategy? So point number one. Point number two, of the 3,799 children in foster care today, the total number of children in hospital overstays across the entire state is 15. That is 15 too many. So on the record, a child in a hospital over a few days for either medical necessity are 15 too many. But more people have been wed to the problem and lifting up and attacking that children are there than actually helping us solve it. Number three, on the issue of hotel stays. As of today, there are 53 children across the entire state of Maryland. Again, I will repeat it on the record, 53 too many, 53 that should not be there. But those 53 are there and in hospitals because of a lack of disciplined attention to this from the Department of Human Services historically. We are stopping it. It will not happen overnight. And it's taking us a significant amount of time to, one, turn around the culture, and number two, work in partnership with all 24 local jurisdictions. I said at yesterday's House meeting that one of the things that's troubling is that for whatever reason, we have developed and allowed to develop in the state of Maryland 25 different departments of human services. That is not correct. There should be one. And it's not central, meaning on Saratoga Street and 24 independent jurisdictions, so that every child and every family who's struggling with mental health issues or substance use or any other issues, they get treated with the same kind of dignity and respect and urgency, no matter whether you live in Baltimore County, in Baltimore City, Queen Anne's, or in Garrett. That has not been the practice. And I want to say that clearly on the record. We are also looking to actually transform policies by looking at how we can actually avoid kids ending up there in the first place, investing deeply in prevention. Every 2 weeks, myself and members of this team sit in the Board of Public Works on the second floor of the State House, and we wait to answer questions about kids who are in out-of-state placements. Per child, we can spend for a single child alone between $300,000 and $1.6 million per child to ship them out of state. That has been the accepted practice in Maryland, and we're saying enough. That is not what we're going to do. To do that, though, isn't by dictate, by this team, by me, by the governor, by you. It's transformation of a long-held belief that we can't do better. We simply will not accept that. So again, 15 children in hospital overstays, unacceptable, but 15. Hotels, 53. And just for the record, what that means is that out of state general fund dollars, we have allowed for year after year after year for well over a decade to spend millions of what are called one-on-one providers. That means if Carnitra is my one-on-one provider and I'm her 17-year-old that's in a hotel, we're paying her out of general fund dollars to be with me 24/7. The cost of that and the risk of that to Maryland is unacceptable.
So I appreciate that.
Sure.
And I hear your passion and I 1,000% agree with what you're saying. And I see in your report here that there are also funds going to the development of more residential
Absolutely.
beds. And so I applaud that. And we need to have a better, more comprehensive response. So we're not spending those millions of dollars. And that is an important economic issue for this state, but it is also just a moral issue and how
Without
we're treating
question.
these children.
Without question.
So thank you.
Without question.
Thank you, Mr. Chairman.
Senator Zucker.
Well, thank you very much, Mr. Secretary. Always good to see you and good to see my colleague, Delegate Kroll-Resnick. Just had a quick question. With the Montgomery County block grant, they didn't spend the money?
They did not.
Okay,
They
thank
did
you
not.
very much. Appreciate it.
They listened to the letter. Thank you. We'd be in a different situation with DLS and DBM.
Yep.
Thank you, Montgomery County.
Secretary Lopez, seeing no more questions, I think that it's important to recognize when we sat here a year ago, vacancies was a big issue. You've dealt with that. Stolen benefits was a big issue. You've dealt with that. And I do feel confident, and I think that the committee feels confident that with stays in emergency rooms and things of that nature, you will be dealing with that. So I just say thank you for your leadership, because it's been very strong year thus far. To my colleague, it's been a pleasure, comparing notes and about the agency, but now you get to work within the agency to make sure that
Tell them what you really say, sir.
I have commented in senior leadership meetings that if I knew then what I know now, I would have been a much nicer legislator.
Well, I think I've always taken a nice approach.
We joke that we're followed by punked cameras this year,
Yeah.
so.
Yep. And since Senator Hedelman did it, she shouted out to folks from Baltimore County. I'll lift up our deputy secretary is a proud resident of District 45.
That's right.
I know that Harry is back there. So Harry's a proud resident of 45. And we also got my Baltimore City director that I always have to lift up and always making sure that we're moving in the right direction. Thank you, Director Stocksdale. And just to my analyst, Sam Quish, just thank you for a phenomenal job as usual, starting it off right. Ms. Tanya Zimmerman, same way. And it looked like we were joined by a special guest, Ms. Natalie Andrade. I think I pronounced it right.
Andrade.
Andrade, okay.
I remember.
Perfect. But just wanted to say, colleagues, this ends the hearing for HHS and look forward to seeing you all tomorrow.
Thank you.